A lot of the companies I talk to, when they say, how are you using AI? They say, we unpack our workflow. We look for particular tasks that AIs can do. We look for prediction tasks within our workflow. We take out whatever process we have there. Sometimes it's a human process. We drop it in AI and we don't mess with the workflow. Our experience so far is that the companies that do that tend to be underwhelmed with the impact of AI. That's because the best it can do is save a little bit of money on whatever jobs or processes it's making a little bit better. The other more exciting element is to think through how can you deliver a better product, serve your customers differently, better deliver on the mission of the organization through AI. And that involves completely changing your workflows and changing the people who are responsible for what within your company.
Okay, we're here today with Avi Goldfarb. Avi, welcome to the show.
Thanks. Great to be here.
Awesome. Hey, for our audience, I'd love it if you could just take a minute, maybe introduce yourself. Tell us, how the heck you got into where you are today with AI in healthcare.
Sure. So I'm Avi Goldfarb. I'm an economist and a professor at the University of Toronto. I was a graduate student in the late 90s, and there was this crazy new technology called the internet. And in economics, at least in my field of economics, one thing you're looking for early on is what industry do you want to specialize in? And I had this idea that since no one knew anything about the internet, because it was new, it would be a good industry to focus on. And so I, did my PhD on the economics of the internet, studying search engine competition. Back when there was genuinely competition between search engines, there were 18 different search engines in my data, and Google was number 17, the 17th most popular in the data set. So graduated from my PhD, landed a job in a marketing department. Many of your listeners may not know, you might not know this, but there's a field of marketing research called quantitative marketing that uses data and models from various fields, including economics, to try to understand consumer behavior. And so the tools I was using, especially the stats I was using in my dissertation, were marketing focused. And so I landed in a marketing department at the University of Toronto, which is extra nice because it was my hometown. And then for the first decade of my career, I focused on trying to understand the economic implications of the internet. I did work on digital divide. I did work on the effectiveness of online advertising, some work on privacy, and a handful of other things, and internet use in businesses. The internet use in businesses work led to the healthcare arm, which is we then applied those ideas to electronic medical records and showed some of the challenges that hospitals face in adopting EMR. And my research career continued as research careers do post-tenure. And in 2012, Agrawal, my co-author, started this organization called the Creative Destruction Lab. And the lab is a program for helping science-based startups scale. We started it in Toronto 11 years ago now, and it's in 12 different universities around the world, including Oxford, HEC Paris, Georgia Tech, and some others. In that very first cohort in the lab, we had this company that said they were using AI for drug discovery. And if you put yourself back in 2012, that seemed insane. It was totally crazy. This idea to use artificial intelligence to discover new drugs, new pharmaceuticals, was just something that wasn't on our radar, and it wasn't on most people's radar. Turned out he was a student who came out of Jeff Hinton's lab, and Jeff Hinton being one of the founders of the current excitement around AI, with one of the core inventors behind deep learning. And the next year we had a few more, and then eventually we had this flood of AI companies, largely coming out of universities around Toronto. At which point we realized, so I'd made my career studying the internet. Jay had made his career studying the internet. Joshua, our third co-author, made his career studying the internet. And we saw an opportunity like, hey, here's a new technology no one knows anything about. We seem to be well positioned to understand it because we're working with all these AI-based startups. Let's try to understand that technology. That led us to work on AI. And that's been the essence of my career since 2015 or so.
Absolutely. What a fantastic story and journey. So now, it's just fascinating. Back in 2012, you're starting this work, and then it evolves. We've since had this pandemic, which has accelerated so much. And I would argue it didn't create anything new. It just, all these things were already in flight, like remote work, AI. So I guess fast forward to today, give us a sense in your words, like the top-down view of how AI workflow, how is it changing the world of work?
In terms of thinking about how AI is changing workflows, there's these two different paths. There's one that's incremental, and there's one that's much more exciting. A lot of the companies I talk to, when they say, how are you using AI? They say, we unpack our workflow. We look for particular tasks that AIs can do. We look for prediction tasks within our workflow. We take out whatever process we have there. Sometimes it's a human process. We drop it in AI, and we don't mess with the workflow. And that seems like it gets you easy wins, because you don't have to mess with anything. You can just take out a current process, drop in a new one, and leave everything else the same. Our experience so far is that the companies that do that tend to be underwhelmed with the impact of AI. That's because the best it can do is save a little bit of money on whatever jobs or processes it's making a little bit better. The other more exciting element is to think through how can you deliver a better product, serve your customers differently, better deliver on the mission of the organization through AI. And that involves completely changing your workflows and changing the people who are responsible for what within your company. That's what we call system level change. That's where the biggest opportunities lie. But there's only a handful of companies that are really doing that so far because it's risky and it's hard. And also because I said, hey, you're changing the humans who are doing things. The people who liked the old system tend not to want you to change it. And so we end up seeing a lot more resistance from people with real power, people with responsibility in the company, to AI-based changes that are about changing the system as opposed to just looking at the workflow, taking out some existing process, dropping a new one.
Absolutely. So it makes me think the World Economic Forum several weeks ago put out this number, just the prediction and talking about the displacement, right, of jobs in theory that AI is going to create was around like 80 million. And then it was like put out this $90 million number as jobs that are going to be created. And that, in my estimation, that's probably low. And we see the same thing again and again, whether it was computing, internet, right? And now we're seeing this again with AI. You just made this statement that the system level changes require the human element of change. What elements specifically, if you get in more detail about that, are changing and what is being displaced versus what is being augmented?
Sure. So when you think about what today's, you can identify what those studies do. Let's start with, what do the studies do that say, oh, a whole bunch of jobs are going to disappear because of AI?
Yeah.
Here's what they do. They look at existing workflows. They look at existing jobs and they say, hey, and then they look at what the AI can do. Say it can do prediction tasks. Maybe it can write. Maybe it can translate from one language to another. So they identify things that AIs can do. And they say, hey, within our current workflows, how many things that people do could an AI do? They say, I haven't seen that particular study of the World Economic Forum saying it's 80 million jobs, but that would say they'd add up all the jobs and conclude that, oh, the things that today's AIs can do make up 80 million jobs in the overall global economy. What's missing from that is once you have AIs doing things, there's new opportunities for your businesses. You can do all sorts of new things and all sorts of things better. And so what those analyses tend to be missing is where the opportunity lies. So think about, lately, a lot of people are talking about ChatGPT.
Yeah.
Okay. And what does ChatGPT do? It does all sorts of things, but one thing it really does well is write coherent sentences, okay, and paragraphs and essays. And lots of humans, as part of their job, write.
Yeah.
And so you might worry, like, look, part of my job is writing. I just wrote a book. So you might worry, if ChatGPT can write, does that disrupt those people whose job is writing? And the answer is probably yes. And that's something to worry about, right? So people especially who make their careers on copy editing and not so much on writing up new ideas, but benefiting from their ability to essentially parse English grammar. Millions of people, presumably, or at least hundreds of thousands of people who make a living that way, and they have something to worry about. So I don't want to discount that.
Right.
But on the flip side, there's way more people whose job opportunities are constrained because they're not good at written communication. Maybe they're not good at writing an introductory letter or a cover letter, or they don't know how to do a back and forth for customer service. There's all sorts of people who are amazingly skilled at things, or maybe they have all sorts of creative ideas, but they don't know how to write them down. But with a tool that could allow them to write, it could create incredible opportunity for those people. You can think about it as it's a kind of upskilling in a way, which is that they have a set of skills that do have real labor market value that lots of people would be willing to pay for, but only when combined with good writing. And in the past, they haven't been able to take advantage of those skills because there wasn't really a way for them to write. Now, if they can figure out how to leverage ChatGPT or other sort of generative AI tools, they'll be able to write well, and that'll allow them to take advantage of all the other skills they have. That's a way to think through a new system rather than just, okay, let's look at the old way of doing things and do it just a little bit incrementally better.
Sure. So then we take something like writing and now it moves into something else. And we say, I can do finance. Well, the machines can do that. I can do paralegal work. Well, the machines can do that. As this moves along, if machines continue to take on like those more transactional and objective components of work, then I guess like beyond, as you said, like these communication skills, which actually are getting somewhat optimized, what are humans left to do? Like, what are the abilities you think the humans of the future, in the future world of work, what abilities will be coveted?
There's two aspects of thinking about the future of work and what the core human skills are. The first aspect of it is, do we really want to work? It's a job. It's not a fun. We think about the major victories of the 20th century in terms of the labor movement, we're about making us work less. We get to have a childhood. We get to be teenagers. We get to retire. Many of us don't work on weekends, or a 40-hour week, or in some parts of the world, a 35-hour week. These are victories about working less, not more. If what technology does is allows us to get the same amount of services, food, clothing, shelter, everything else we might want with fewer hours of work, for most people, that's a win. Aspect two is it's a lot easier to identify that the jobs that technology is going to disrupt than the new opportunities that are going to be created. And because what we can say is, oh, here's some things humans do, and here's what the machine does, and we can figure out that replacement. And so it's easier for us to worry about what's going to disappear than for us to imagine all the new ways of work. If you talk to somebody in the 19th century to imagine what all of us do today for work, it would have been almost impossible. The work world is so completely different than it was back then. The new jobs that computing and the internet created, think about the number of people who work as programmers. That was unimaginable in the 1930s. It's kind of a way of saying, I don't know what the new jobs are going to be. Yeah. I just am confident they're going to happen. But then let me dig in a little bit in terms of what the machines can do and what they can't do.
Yeah, absolutely.
Okay. Our first book is called Prediction Machines. And it's called Prediction Machines because when people talk about AI today, the technology that exists today is not like the machines of science fiction, where we have machines that can do just about everything we can do. It's a very particular technology called machine learning, has gotten much, much better over the past couple of decades. And so the reason we're talking about AI in 2023, and we weren't talking about it in 2003, is because of these advances in machine learning. And machine learning is a branch of computational statistics. And that means it's prediction technology in the statistical sense. Right. What today's AI does is it's excellent at taking information you have and filling in information you don't have. So prediction is the process of filling missing information. And that's it. That's what AI does. That's what today's AI, not what every imaginable version of AI does, but that's the reason we're talking about AI today. Prediction is a big deal because it helps us make better decisions. So whenever you make a decision, prediction is a component of that decision. But there's this other component. This other component is this thing we call judgment. Judgment at a high level is knowing which predictions to make and what to do with those predictions once you have them. That remains inherently human. And for the foreseeable future, figuring out which predictions to make and what to do with them once you have them is going to be human, because that's not what prediction machines, that's not what today's AI does. And so we think about the machines are doing prediction. They're taking information you have to fill in information you don't have. And the human decision is about judgment. What prediction should we make? And what do we do with those predictions once we have them?
Excellent. And as you were going through that, you made the comment of you can't really predict what jobs it's going to create. And in a lot of cases, you can't even predict the impact it's going to have on certain sectors and expanding them. I think one of the case studies you used in prediction machines was around the introduction of the ATM into retail banking and how it actually, contrary to what you would think, led to more expansion for banks, right? Because the people inside the bank. I don't know if you want to use that scenario, or maybe you could use a different scenario if you just wanted to explain that to the audience so they could understand how things like that phenomena plays out.
It can be surprising how technology can change the number of jobs and who does what. The example we gave in prediction machines is this example as from Jim Besson of BU of ATMs. And so when ATMs diffused, you would think that there'd be fewer bankers and fewer bank tellers. But in fact, as ATM diffused, we saw something quite different, which is we saw more employees at retail banks. The reason we saw more employees at retail banks is once we had machines essentially doling out cash and taking in cash, the employees at the banks, at the branches, were free to do much higher value work. In particular, helping people manage their finances, marketing new programs, and helping people ultimately structure their banking lives. There was a lot of work for people that when the person at the bank was just a teller and all they did was take in money and dole out money, they didn't have the bandwidth for that. But once the world changed and they realized, oh, we can do other things, they did a lot more other things. That's what happened with ATMs. Going forward, we can imagine something similar with AI. When I say we imagine, because it hasn't quite played out yet. So think about medicine, okay? In medicine, a lot of the doctor is at the center of the medical system, the physician. Why is the doctor at the center of the medical system? Because they have years and years of training in all sorts of things. But the thing that they have that the nurses don't have and the pharmacists don't have and others don't have, one particular thing is diagnosis. They are particularly good at taking in information about your symptoms and filling in the missing information of the cause of those symptoms. Diagnosis is prediction. It wasn't obvious to us 20 years ago, but it's increasingly clear that it's prediction. And it's something that AIs do well already, and they're likely to do better and better over time. So what does a medical system look like if we have AIs doing diagnosis? One version of it is we just get rid of the doctors and replace them with AIs. Okay. But we keep the current workflows the same. Maybe we have, and that sounds, okay, it's bad for doctors' jobs, and maybe it's going to be a little bit cheaper for the rest of us because doctors are expensive, but otherwise it doesn't sound like medicine's going to get that much better. Another version of it is, I should say we're not getting rid of all doctors, you still need surgeons. Another version of it is we create a new kind of medical professional that maybe we continue to call doctor, where with an undergraduate degree, you learn how to help people manage the stress of the health system and a health crisis. And you learn how to work with a prediction machine in order to do things better. And so it's not 10 years of post-high school education or more. It's 4 years, because what you really need to be focused on is what doctors say is a lot of what their job is, helping people deal with a medical crisis. Then maybe the training the doctors have isn't quite the right training for that. So we have an entirely new kind of healthcare professional, which would require a new kind of training, a new way to interact with the health system, new insurance processes, all across the board. There'd be massive changes that would lead to better care, potentially less costly care, and the medical professional focusing on the skill that they can do that the machine can't, which this particular example would be on the emotional stress side of things.
Brilliant. So we've spent our conversation up until this point focusing on the individual and the impact on them. I'd love to switch it for a second and let's talk about the business. Right? And I believe that as a business society community, our sophistication is really not there when it comes to performance measurement, especially if we're going to be coveting those people that have good judgment, right? So the subjective decision-making, I think you could argue that as machines take over the more transactional, then humans are doing the more relational components. And in some ways, it's like we're going to be relying on humans to be more human. But those elements we're awfully good at from a heuristic standpoint and identifying, but really bad at objectively identifying those measures. So just wanted to get a sense from you. Do you have any thoughts on like how we should think about what is the value of a human in the work context? Like how do we start to figure out those attributes?
So what you just described in saying, what's the value of a human in the work context? And how do we think about measurement, human performance for the more human aspects and less mechanical aspects of work? That's about judgment. That's about knowing what we value, knowing what matters, and trying to figure out what is it that the organization is trying to optimize. What are we trying to achieve? What's our mission, and how do we measure it? So those things, just first of all, that remains inherently human because that's not what prediction machines do. The organization's got to figure out what their mission is. So start with, what are you trying to achieve? So in our new book, Power and Prediction, our emphasis is you start with your mission. What is it that you're trying to achieve as an organization? And then you think through, okay, what can we measure that is about the thing we're trying to achieve in terms of our end objectives? Then you think through, what are the core decisions we make in our organization that allow us to end up achieving our mission? And then you go to the measurement and predictions on that. For example, this is at a pretty abstract level. So for example, in the medical, what does a hospital do? What does a medical organization do? There's fundamentally two decisions. Feels like there's lots of decisions, but there's really two types of decisions. There's a treatment decision and there's a resource allocation decision. And the way hospitals typically work is on the ground, doctors make a treatment decision patient by patient, and the hospital management makes a resource allocation decision in terms of what resources should be available to the doctors who are making a treatment by treatment decision. So you think through, well, what's the mission of the hospital? What are they trying to achieve? Different hospitals might have slightly different missions. And then you think through, how can we use better prediction technology to enable better resource allocation and better treatments in order to better fulfill our mission? Some hospitals might be focused on low-cost care. They're going to do things differently on resource allocation and treatment. Some hospitals might be focused on saving lives no matter the expense. Okay, obviously can't quite be no matter the expense, but different kind of focus. Some might be on community care. Some might be on certain aspects of acute needs. Those aspects of the mission will end up feeding into the decisions they make on treatments and resource allocation, which will in turn then feed into, okay, what predictions can we make to improve treatments, around diagnosis, for example, and patient needs. What kind of patients are going to come in? That's going to be on resource allocation. And then our judgment, this really super important human aspect of it, which is how do we choose to allocate resources? Like, what are our priorities? Is it about cost reduction? How do we weigh containing costs with saving lives, for example?
There's a lot of tension right now between, I think you would argue, it ebbs and flows, but now a lot more than it has been between the employee and employer, the employee-employer relationship. There's a lot of friction. If I were to make this statement, the employee-employer relationship is broken, how do you respond to that comment? And what do you attribute to your beliefs?
No, I have no idea. Sorry. That's just not my expertise in terms of thinking about whether the employee-employer relationship is broken. I can say it changes.
Yeah.
There's change, whether it's broken or not is not my expertise, but there have been changes because of remote work. There have been changes because of changes in technology. And these changes, some of these changes have been going on for 40 years plus.
Yeah.
But the old story of you get a job out of school and you stick with that company till you retire, that hasn't been around for 20 years anyway. And that changes the connection you have to your employer. And then as over the last few years, we've moved to remote work where you don't even have the same interpersonal connections with your fellow workers. That can make you more, in some ways, that's fine in terms of from the firm point of view, because it might make you more productive, but it might make you less connected to your team and to the organization overall. So there's changes. So that's a less connected, but there's also a more connected, which is, hey, you know what? It's much easier to do my job if I don't have to spend an hour each way in traffic.
Absolutely. Yeah.
And so that's why I'm saying, I don't know if it's broken. I could just say that there's been changes. And I just highlighted a handful of those changes.
Totally respect that. Have you done, as you've done your work and you're looking at AI and other technological advancements like Web3, have you done any work in that space?
Not working Web3. No.
Okay. Got it. Avi, this has been great. I appreciate all of the information that you have provided today. Is there anything that you want to touch on that we didn't talk about?
No, I think we covered the main things. Just when you quote me on that health in terms of the cost lives trade-off.
Yes.
That's a nuanced thing because
absolutely.
So I don't mean to, because it implies that you're putting a price on life, which is not what I mean to apply. So if you do quote me on that.
Yeah, totally get it.
Yeah.
Careful. It's in general, that statement, how do you value a human in the work context, is a loaded one, but we've gotten some really thought out, including yours, responses that I think are important to the conversation as we think about this new world forward. Hey, thank you so much for the time today. Greatly appreciate it. It's so nice to meet you.
Great to meet you too.